So how do you help your patients choose their breast size when you're getting ready to put in a breast implant?
Most of the time, it's interesting that as time goes on, in the old days when I actually used to be younger, we used to make the breasts a little bit larger because people used to ask for larger implants. But as times have gone, probably the most common size that people ask for right now is somewhere in the C cup. Or at most a small D. It's not that often that we get patients in our practice that they come in and walk in and they say, I want a double D. We still see those, but not that often.
Right.
And it's not that often also that we get patients that want a B cup. I mean, they obviously are at an A or a B and they want to get augmentation, so it's not that often that they just want a small B or a B cup. So most of the time it falls into the C and D range. So depending on what they look like and stuff, that's actually a really good size to go with. Because if you don't make the breast too big, and if you help them pick different sizes, which we do by pictures, computers, different bras, different techniques to come up with different sizes, you can have a beautiful result. In fact, today I saw a patient that I did her breast augmentation 10 years ago. And she had she came in for a 10-year follow-up saline implant, and I didn't even know if it's saline because when I felt the breast, it was so nice and soft still. But the beauty of it was that she actually had a child, had breastfeeding. She did breastfeeding, and the breast still looked spectacular after 10 years of having a child. And the reason for it is not only the technical reason of doing a nice breast augmentation in the first place, also the size was enlarged. The size, even today, she's like a mid C to upper C cup. So even though she had pregnancy, the breast got larger, they retracted back down, still had a beautiful result. So hopefully her implants should be good for quite a few more years.
So she wasn't inquiring about replacing them, she was just in for a routine follow-up, and with all that going on in her life, she still had a beautiful result with her saline implants.
Absolutely. She had a beautiful, she just was coming back for a 10-year follow-up to be seen, and I saw her, she was great. I told her, well, you know what, I don't even have to see you for 5 years or so.
Wow, that's
unless
awesome.
it deflates, because it
Right.
eventually deflates.
Right.
So.